Your Royal Highness,
صاحب السمو
Excellencies,
الملكي،
distinguished guests, good
أصحاب
morning.
المعالي، سيداتي
My
وسادتي.
name is Lema Ghazawi, and it is my privilege to welcome you to the inaugural International Conference on Conjoined Twins, held here in Riyadh, Saudi Arabia. This conference is a historic milestone bringing together global leaders, medical experts, and advocates to discuss the unique challenges and opportunities in caring for conjoined twins and their families. Today also marks the first ever United Nations World Conjoined Twins Day, which reflects the growing global recognition of their courage and resilience. Over the next 2 days, we will explore cutting-edge advancements in medical care, ethical considerations, and collaborative strategies to improve the lives of conjoined twins. Together, we aim to build a framework for global cooperation and advocacy. We begin this historic event with the ministerial-level roundtable, Global Collaborative Approaches for Significant Synergy and Impacts. This session brings together global leaders to discuss how international partnerships can address their challenges faced by conjoined twins and their families, while fostering collaboration across healthcare, education, and human rights. The session will be moderated by Ms. Juliette Foster, an award-winning journalist and broadcaster. Ms. Foster, the stage is yours.
Good morning, Excellencies, distinguished guests, ladies and gentlemen. As you heard, my name is Juliette Foster, and I would like to welcome you to this important, unique international conference on conjoined twins. Now, when I began reading about conjoined twins, the first and perhaps most obvious question that I asked myself was, how many conjoined twins are there in the world? It is a difficult question to answer as there isn't enough reliable data, but the prevalence of conjoined twins is estimated at between 1 in 50,000 pregnancies. Furthermore, according to data from the University of Minnesota, conjoined twins occur once in every 200,000 live births, while the stillbirth rate is high, with around 60% of twins dying either before or shortly after they are born. Now, over the centuries, the social language around these children has changed as perceptions themselves have shifted. Gone, thankfully, are the days when they were disparagingly referenced as abominations or tragedies of nature, or Siamese twins, for whom the future was either social isolation or eking out a living as exhibits in circus freak shows. Today, there are countless examples of conjoined twins with normal, healthy lives in loving, supportive relationships and enjoying successful careers. That journey of progress has been recognized by the United Nations, which, thanks to an initiative by the Kingdom of Saudi Arabia, has formally designated November the 24th, in other words, today, as World Conjoined Twins Day. Indeed, Saudi Arabia itself is a world leader in performing the complex, delicate surgeries for separating these twins. And this roundtable also marks the 30th anniversary of the Kingdom's Conjoined Twins programme. So, congratulations. But while the outlook for these children is showing signs of progress, we must not be complacent, as the road ahead is lined with multiple challenges. Where conjoined twins are born will impact their access to healthcare, a good education, and decent social prospects. When exploring the challenges, it's important that psychosocial stressors, ethical and religious dilemmas, and even public relation considerations are not excluded from the conversation. Given those realities, how can we address the imbalances that deny conjoined twins, in fact, a fair deal in life? How do we ensure that their basic rights are incorporated into wider international agendas around education, health, and human rights? How should humanitarian agencies work and support countries with limited resources go about the business of building and coordinating strategies for timely intervention? Well, these and other related areas will be explored by a panel of experts specializing in healthcare, medical innovation, education, and human rights laws. So, let's meet them. First, I would like to introduce His Excellency Dr. Abdullah bin Abdulaziz Al-Rabia, Advisor at the Royal Court and General Supervisor of King Salman Humanitarian Aid and Relief Centre, KSA. Dr. Al-Rabia has written extensively on conjoined twins and is an international authority on the separation surgery. Excellency, welcome. And let us extend the welcome to His Excellency Dr. Nadeem Jan, who is an internationally recognized expert on public health governance and public policy, and is also the Federal Minister of Health for Pakistan. Excellency, you are welcome. Nancy Ossie is President and CEO of the Los Angeles-based global humanitarian and medical relief organization, International Medical Corps, which operates on the front lines of war, natural disaster, famine and disease outbreaks in 30 countries. Nancy Ossie, you are welcome. Please join us. His Excellency Dr. Bandar Al-Kanawi, MD, FRCPC, and Chief Executive Officer, KSA, is the CEO of Health Affairs at the Ministry of National Guard, an organization comprising 5 medical cities in Saudi Arabia's 5 major regions. Dr. Kadawi is also President of King Salman bin Abdulaziz University for Health Sciences. This is a position he has held, in fact, since 2009. Finally, the Right Honourable Professor Lord Ara Dazi is co-director of the Institute of Global Health Innovation at Imperial College London. He also holds the Paul Hamlin Chair for Surgery. Professor Dazi serves as a consultant surgeon at Imperial College NHS Trust and the Royal Marsden NHS Foundation Trust. I also feel as well that I need to explain the initial NHS, that is the National Health Service. The National Health Service of the country to which I belong, the United Kingdom. So that is now cleared up. Let me give you a very quick idea about what is going to happen. We will be having a panel discussion, so I've got plenty of questions that I would like to put to my guests. And there will be an opportunity for you, our audience, to ask them questions. I will guide you as to when that is. Microphones will be available, but let's first begin with our Q&A with our panel. So panel, it is very good to see you. And I would like to start with you, Nadeem Jan, because there is so much happening in this particular area around conjoined twins. But I want to focus on diplomatic relations. More specifically, my question to you is, how do you feel that these relations can be leveraged to ensure that conjoined twins and their families are given access to the best healthcare facilities, not just in their country, but around the world?
Thank you very much. Bismillahirrahmanirrahim. First of all, I would like to commend the fantastic work that King Salman Humanitarian Aid and Relief Center has been doing across the globe. I'm privy to your information. Last year around this time, there was an earthquake, massive earthquake in Afghanistan. And we wanted to support Afghanistan, so we thought we would be the first country to be supporting Afghanistan at that moment. And I tasked my team that we should immediately rush to Afghanistan so that humanitarian aid can be delivered there. I was astonished pleasantly that we were not the first. The first were King Salman Humanitarian Aid and Relief Center, already working there. That was a treat to the eyes. I think the diplomatic efforts that the world has been doing in many initiatives, they need convergence and unison. We should move from all kind of verticality into integration and from silos into meaningful collaboration. The diplomatic efforts in unison can deliver much, especially on an agenda which is so low at the international stage. And I must commend the spirit behind all this, Dr. Rabia, for bringing us all together. Had he not been there, we would not have come together here, Excellency. So that channelization of diplomatic efforts for a cause requires diplomatic unity amongst the states, donors, implementers, and all kinds of humanitarian workers. So the impact can be generated. We know that there is scarcity of funding, there is scarcity of political space also. And that we can tap that resource if we can build a strong, impactful diplomatic alliance. Now, I would like to add to it also. There are a couple of opportunities which this new initiative can tap in. One is the World Health Assembly. Each year, it's celebrated. We would like the spirit behind all this, King Salman Humanitarian Aid and Relief Center, to chalk out at a strategy in unison with interested parties and actors, that a space is created there for a dialogue at the World Health Assembly, maybe in the session or at the sideline event. The second opportunity is UNGA, UN General Assembly. Again, if all countries and actors come together with a strong voice and they occupy a space, maybe in the main session or at the sideline event on conjoined twins, and they care for their life, it would be a big impact, it will bring a big impact, and also would provide care, rehabilitation, and management of the conjoined twins. Thank you.
Thank you so much for that. So we're looking here at global alliances at a diplomatic level, and presumably, Dr. Al-Rabia, it needs to actually trickle down to the ground. So my question to you is, how do you think that humanitarian agencies can actually work with support systems to help conjoined twins?
Well, first of all, good morning to all of you, and thanks actually for the good introduction that you have put forward. I think you are becoming an expert in conjoined twins. Your research is better than mine. And carrying on with His Excellency's remarks that he mentioned, my brother, I think there is a big room for the international agencies. Let us start with the UN, and let me also appreciate the UN gesture with the request of the Kingdom of Saudi Arabia, and let me also thank our Foreign Ministry and also our beloved Ambassador Abdulaziz Al-Wasil. They have been working with the UN to have this day is the International or the World Day of Conjoined Twins. So with the UN involvement is number one. The international NGOs, and I have Nancy here next to me, and she, I'm sure, international agencies are extremely important, but we should not forget local and regional and NGOs, because they are equally important. What is needed? I have been with those twins for 35 years. Most of them, they come from disabled families, remote areas, fragile health system, and limited income to cover the costs. So number one, we have to have a very good awareness for them. So we hope now, as of today, we are starting together. Secondly, how can those NGOs give them the early assistance, whether it is psychological, social, financial support to come? Some of those children, they don't even have the money to have a passport. Name it, to reach, for example, a reference center. And also, thirdly, which we hope today we will launch it, is an international website, which is not only a connectivity website, but it is more than that. And having a website where the twins can reach, where also the UN and other agencies will reach. And I thank both WHO and UNICEF for also being highly supportive of the platform that we are working on. And we invite also other players to work. So if we take all of those together, I think we are engaging UN, international NGOs, regional, local, plus reference centers, like, for example, the Saudi National Conjoined Twin Program. I know Great Ormond Hospital, they have a program. I was talking to them last night, and many other players. Those players have to be incorporated into one body so that we link the know-how better. Lastly, it's not only to do the surgery. There is a long gap in front of us. When you do the surgery, that's the start of conjoined twins. You have a lifelong follow-up. And one thing that I wish to see in the future is to invest in the research, in the prevention, first for early diagnosis, prevention, and then we take it from there. Thank you.
Thank you very much. There is... What is evident is the goodwill, not just on the panel, but also in this room to actually fulfill these objectives. And Lord Darzi, we can talk about cross-border access and cross-border collaboration, But in hardcore terms, how do we do it? How do we improve it?
Thank you. May I, first of all, thank His Excellency Dr. Arabia for inviting me here. It's a great privilege to be back. This is my third trip to the Kingdom in 6 weeks, sir. So it's a privilege. It's also a privilege to see you in this, your leadership, your global leadership, by the way, on conjoined twins. Now, I'm not an expert. I'm a surgeon, by the way, but unlike Dr. Arabia, I'm a much more simple surgeon in terms of what I do. But we have a principle that really was driven at the time when I was a health minister in the UK. You centralize where necessary and decentralize where possible. So in the UK, with 66 million people, we have one center in the United Kingdom that actually manages conjoined twins. And that's very, very important because at the end of the day, quality, obviously access, is the most important part of outcomes when it comes to conjoined twins. I'm going to give you the 5 principles that we use, and that is building a specialist center. There we have dedicated facilities in Great Ormond Street. We have a global training program, which is a great privilege to really host many gifted surgeons from across the world, and more importantly, the interdisciplinary nature when it comes to managing these very complex cases. The other one is the cross-border collaboration. The sad fact is this world today is more fragmented than it's ever been before, and that's a serious challenge when it comes to complex surgery related to conjoined. It does not work in the advantage of this sadly, this condition. So in many ways, DFID, which is the arm of the, no different than KSA Relief, makes significant contribution in terms of funding and through international organizations or paying for high-cost travel. Simplifying medical visas. That's the, getting in the UK is not easy. Any one of you wanted to get some visa, it's not that easy, certainly when you have a medical condition. And obviously, we had to adopt and tailor the service very much based on the cultural sensitivity. So access is extremely important. Obviously, as we heard earlier, research, innovation, transformation has been really, and again, coming back to His Excellency, what's happened in the last 2 or 3 decades in this type of surgery has been remarkable. Really, truly, truly remarkable. And you can only do that, you can only learn by measuring it. So having global registries is critical here. And I think that's something that we should really drive and work with. Collaborations, research initiatives. I mean, there are some amazing new platform technologies that have a huge impact on conjoined twins in terms of imaging, augmented reality, in terms of surgical planning, in terms of the use of AI. And recently, so one of our gifted surgeons in GOS doing a big procedure in Turkey, for example, based on AI. And obviously ethical and psychological consideration is a very important one. Counseling, how do you get that to many of our partners in lower and middle income countries? Ethical oversight. So these are the complicated factors really that will build a comprehensive center that could manage 66 million people. But then how do we get that? Obviously through the different borders across the globe in managing these challenging surgical procedures.
I mean, I like the idea that to take a British expression, it's joined up thinking, joined up government, because you talked about bringing in different departments to make it easier, for example, to actually navigate the passport system, the visa system in the United Kingdom. It is complicated, but it is complicated around the world, wherever you go. So that joined up thinking needs to work at that very basic level.
Completely. I mean, you have 3 ministries in the UK working together on this. It's not just the health ministry. That's where you might be receiving care. You have to get the ODA, the foreign ministry, the regulatory platform to accredit people to do certain things. The ethical consideration has to go because it's within the UK law if these people are transferred to the United Kingdom. So it's a very complex set of not just health diplomacy.
It is complex, but the good thing as well is that there's a lot of research which is happening in this area, and research, as we know, is borderless. But let me put this question out to the whole panel because we're talking about systems, making sure that they are effective for those who are going to need them the most. But at the same time, how can we safeguard the basic human rights of conjoined twins because their medical needs, their social needs are extremely complicated? How can we actually feed that into these new structures? Dr. Arabia, can I put that question to you, and I would invite the other members of the panel to contribute as well if they wish.
Well, as my friend Lord Darcy mentioned, it's an interconnected, actually, network. And as has been mentioned, the health system is the last one. I think it's the integration of, first of all, having the ethical laws, and I'm sure conjoined twins, all of us know that if you need to read about ethics, know conjoined twins, and there are many researchers in the kingdom, and we have Dr. Hala Alam, who is looking at me here, who is our national expert in the ethics of conjoined twins, and we have experts in Great Ormond Hospital and elsewhere. So the ethics and the rights of the conjoined twins, you have mentioned, Juliet, in your introduction, few centuries ago, they were actually being thrown out of communities, and they were expected to be devils, and you name it. Now they have the rights. The physical handicap should not deny them their rights, and this is something that we should stress. I hope in this conference we stress on this. So their physical handicap should not deny them their rights. They should have their rights in schools, in jobs, and you name it. And I'm sure you will see the twins later on in the opening session. And I'm sure if you talk to them, they will tell you what rights they have been denied in their home countries. The other thing is also connectivity, and the foreign ministries is very important to have the atmosphere and the connectivity to allow those twins to reach the centers where they need to be taken care. Let me just close by, we are fortunate to have a very mature health system. Our Minister of Health, His Excellency Engineer Fahd Al-Jalajil, who is in front of me, has refined a very good health system, which is really allowing digitalization, high technology environment, and also the atmosphere to have a success. And also we should not forget the National Guard Health Affairs and His Excellency Dr. Bandar Al-Ganawi, who is with us today, who has also created, I would call it, the fairest digital latest technology conjoined twins operating room. All of those are integrated. And I'll stop here.
Thank you so much. Would anybody else like to add to that at all? But before I move on to you, Nancy. Okay, Nancy, let me take a question to you, because look, I want to take the question back to systems, because your organisation, it has an impeccable record for responding to emergencies in countries where the support systems are either on the verge of collapse if they are challenged by conflict or natural disasters, or indeed they have collapsed, so those on the ground have to work from scratch. And the point that I want to raise to you is that conjoined twins or other vulnerable groups of people, their fragility is enhanced because there is that danger of prioritization. When you have a system which is broken and it's running on the bare essential, tough choices have to be made. That puts the doctors in an extremely unpleasant situation. How can you bypass that so that nobody gets left behind?
Okay, well, thank you for that question. And I just want to start by thanking His Majesty King Salman and His Royal Highness, the Crown Prince, and experts like His Excellency Dr. Al-Rabia for establishing this center for the support, the compassion, and the recognition that many families around the world do not have the resources in low resource settings to access this kind of surgery, or to, have an opportunity to have a different life. So this compassion is just brilliant, and I just want to mirror what has been said on the panel about the important initiative. So in low resource settings, to your question, International Medical Corps, our expertise happens to be to try to reach people in the greatest needs, which means that not in addition to low resources, they're often living and struggling to live in conflict zones. And so because the majority of our work is in conflict zones, we have, of course, come across many situations. Our focus, to your question about priorities, is to really prioritize the most vulnerable. Now, who is the most vulnerable in many of these environments? It is women, it is children, it is the elderly, and it is people living with congenital disabilities. And so that is the people that we focus most on and how we try to reach them. So there are different ways that we try to reach them, but we know that in a conflict area, most of the coping mechanisms and most of the things that used to work to provide the support that a family needs are shattered. People are displaced, they've lost their own family members, they've lost their homes, and they are already compromised because of the fragile conditions. So from the outset of our emergency response, we integrate and we reach out to people living with disabilities because we know that's going to be more challenging for them than it is for many others. And we do this by reaching into what exists in these environments and trying to connect them to the services that are still existing. For instance, in Lebanon, where we are working, we recently referred someone with a congenital disability to a referral center where they could get the help that they needed. So all of our work, when we work in these environments, is based on what is available in the environments, what gaps are there, what referral systems are there, what community services exist. Sometimes it's just connecting them to what is needed. Other times it's providing physical rehabilitation if it's an injury, or devices. Sometimes there's small, simple solutions, but a lot of our work is multidimensional, and its focus is on connecting people with the services that may be available and then providing services directly that may not be available.
Okay, thank you so much for that. I mean, just listening to Nancy and all of our panelists so far, Dr. Kanawi, what emerges, apart from their commitment and the reality of what they experience on the ground, is the pressure on health systems to be nimble in times of adversity, but also in times of peace. And my question to you is, how do you personally believe that a comprehensive healthcare system can be tailored to address the needs of conjoined twins? Because I assume you cannot take a one-size-fits-all approach, as every case throws up its own differences.
Thanks, Juliet, again. Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. Again, I would like to join the team here by saying that really congratulate the Kingdom of Saudi Arabia for really leading this global initiative, and as well for my colleague, Dr. Rabia, for really championing this progress, and as well, creating this world initiative which is the 24th of November. I will come down to the really how do we manage these cases from a healthcare management rather than from the approach of surgical approach or otherwise. Clearly, the National Guard, the Health Affairs, the King Abdulaziz Medical City is the national center for the conjoined twin management. And as you said, Juliet, there is no doubt that it needs all of the different disciplines to ensure that we really care for them in the best way we can. The idea or the whole thing is to really reach to an important outcome for them, that they become healthy and integrate them back into the society. So looking at the multidisciplinary teams that the National Guard, for example, Health Affairs has assembled is quite large, actually. From a medical point of view, and as well from an allied health, and from the other enabling areas like social services, psychology, and many other areas that we can do. If we focus on the surgical part, which I'm not a surgeon, I'm a gastroenterologist, however, I've been in health management for a while, and we can see that each case, each problem, or each conjoined twin has a unique way of being conjoined. So clearly that we have to assemble the team which would be really capable of doing that, and as well able to lead forward in that kind of an approach. We really have a major assessment, and as well clearly delivering this on not only surgical part, but the other parts like nutrition, pediatricians, rehabilitations, and many other areas to ensure that the outcome of surgery will be quite successful. We know that some of them actually go through multiple phases of surgeries, not only one surgery, but it's multiple phases of surgery. For example, conjoined twins in the head, or neurological conjoined twins. They really take more than 4 stages of surgeries in order to ensure that they really reach that. They have lots of preparations, they have simulations, different departments like radiology, laboratory medicine. So this really requires a comprehensive system. And not only that, you need a comprehensive system which is capable of taking care of the difficult challenges that they meet, and ensuring your laboratory medicine as well is capable to handle infections and to handle complications and many other things. So this is where I think being more of a centralized or a national system, or at least a system which is really has the capability and develop experiences over a period of time, would be able to do it, because there are multiple areas of engagement through that. Sometimes, these conjoined twins have heart problems, so you need maybe to manage the heart problem before you do the surgical final stages of separation. So the story goes on, and I think centers which deal with conjoined twin has developed over time lots of experiences and lessons that they can share with other centers. And clearly, our system has been taking care of multiple surgeries, almost 60 now, and as well they have evaluated more than 100+ cases which deemed some of them not amenable for separation. Developing as well the teams, and continuing to make sure that these teams are continually skilled and being competent, because I think that's as well a very important challenge to ensure that you transfer this to the next generations of surgeons, physiotherapists, radiologists, neurologists, and the rest of the medical teams. I don't want to elaborate on them, but it is as important as it is. In addition to the support, nutrition is very important. So these people require specific arrangements, they require rehabilitation, and as well long-term physical and as well psychological rehabilitation.
Yeah, and that's important, because what you've done is you've actually extended Dr. Daziz's answer at the beginning, because you talked about the importance of having that centralization. But what has been outlined in that answer is not just serving the needs of the twins now, it's also, if you like, a training hub as well, where skills are passed on, but also the thinking goes beyond the surgical.
Absolutely. This is a true example of, you can't question the centralizing powers that drive this. The numbers are small. If you're going to keep your skill, you're going to really aspire to drive high quality services for these unfortunate presentations, you have to centralize services. And that's absolutely clear in our minds. And obviously, by centralizing resources, you're not just improving the quality, but you're also much more cost effective. Numbers,
sure,
games is what makes surgeons.
And that's the point as well, because we are living in a climate where numbers count, where people are actually looking at the money. Sorry, did you wish to say something, Dr. Kanabi? Please add that.
I think the other follow-up that I would like to have is, as well, not taking care of the children themselves, yes, but as well their family and extended families, because this is really important, and that's what really makes it quite important that you integrate them within the as well medical team, to make sure that they are socially and psychologically supported, and as well financially supported, because they really feel they need to be hugged, they need to be really embraced within the healthcare system. And within our system, we really have a very clear pathway for them. Very clear for the family when they come and continue to take care of them. Even we take care of their, medical issues if they need to be. So that's, I think, very important, and the support that, we get from King Salman Humanitarian Center is very essential to lead this. So it is not only the medical institutions, but as well the extended enabling systems that they need to have as well.
Thank you so much for that. In some ways, you actually preempted the question I was going to put to Dr. Jan, because, look, the bottom line is that we've been looking at structures in terms of cross-border cooperation, making sure that those patients can get the help they need if there is a difficulty in their own country. But beyond the structures and the medicals, we need to make sure, as Dr. Kanawi has pointed out, that families are supported beyond the medical stage, the actual surgery. So my question to you is, what are the global initiatives that need to come together to provide that long-term support once the surgeries have been completed, once the families are actually instructed about nutrition and the things which they can do to help those children enjoy normal, long, healthy lives?
Thank you. It's a rare phenomenon, conjoined twins. And in this competitive environment, it has occupied less space. Now, there are a couple of options. If a global alliance is built, which has this conjoined twins as one component, but we stitch into it the other rare diseases also, like hemophilia, thalassemia, hearing impairments, speaking impairments, and package it into one, I think this can build a global momentum. So that alliance, of which conjoined twins will be an integral part, and it will take its leadership from here, the spirit from here, but it can unite the world for a global alliance against all rare phenomena, rare diseases. That's one. Vertically, if we want to go vertically as a global alliance for conjoined twins, there will be many more challenges. So I'll suggest that it's packaged into that rare phenomena, rare diseases, and then a global alliance and global momentum is created. It will create a big impact and will be successful. Then added to it, I think we need also a global action plan on these rare phenomena and conjoined twins. Linked with this, a global advocacy and funding strategy. And also the transfer of technology, human resource, skills, expertise, north to south, south to south. Because as I heard from colleagues, there are less specialists available, and the political will in that equation will not be that high as well. So we need to tap both. The skills, we need to maintain that, when we need to create a political will at the national level as well as at the international level. And I think I throw it for the session, but anything we spiritually believe, anything that starts in Saudi Arabia, that has got barakah, that has got a special blessings. So I'll suggest and I propose to Dr. Rabia that he announce a big initiative, and inshallah it will be successful. You will find us railing behind you and many more, and success will touch our feet. Thank you.
Thank you very much. Thank you. Let me bring Nancy back into the conversation. I've been watching you, you've been agreeing with everything, so no disagreement there, which is perfect. But look, we can talk about things happening at an upper level, the level of government and amongst the NGOs, but we should not forget what is happening at ground level. And from your experience, have you seen strategies that encourage community acceptance whilst recognizing sensitivity around the needs of conjoined twins and indeed others who have unique disabilities? So really, it's getting stakeholders engaged because they're part of that journey. We can talk about the big structures, but there has to be a beginning, and it's on the ground.
Yes, thank you for that question. And it really is an honor to be on this panel and to receive the insights and the wisdom of everyone here. And I was reflecting on some of the comments that have been made just a few minutes ago. A big part of International Medical Corps' work on the ground, and by the way, supported very generously by KS Relief, so thank you for that. A big part of that is trying to work with communities to remove some of the social and cultural barriers that exist around our world, and some of the stigma that comes. And as was mentioned before, the support of families is very, very important. And especially in environments where people have lost so many of their family members, and bringing other family members together to provide that support. So I'd like to give you a few examples. So during the Pakistan earthquake, we encountered a woman who was about to give childbirth, and her baby had a congenital deformity, and she was afraid. She knew in advance about this deformity. She was afraid to give birth. And we knew that we could help and provide her with a cesarean operation, but she was afraid. So we spent time with her and her family and helped her overcome her fears about giving childbirth. And this is in the middle or after the recovery of an earthquake. Sometimes it could be a situation like during the Turkey earthquake. We came across a young boy who had a congenital deformity. And it was something as simple as providing him with a special wheelchair so that he could live a more normal life. And so sometimes it's a simple device. There's another aspect to our work which is critical, and that is what we tend to call them child protection or child-friendly spaces. What is a child-friendly space? I'll give you an example in Gaza, where many children, as we know, are being injured. And we are performing amputations at our field hospital inside Gaza. But afterwards, that child needs support. Often they've lost their family. They're suddenly living with a disability they didn't have before. And so part of our child-friendly spaces is to reintegrate children back into their communities, back with families that still are there, and to help them learn to be a child again with a deformity or a disability that they hadn't had before. So sometimes it's an injury, sometimes it's something through childbirth. We have seen this in Iraq as well. These child-friendly spaces are so important to helping children become children again and helping to provide them with the emotional support, but at the same time their families with the emotional support as well. And so we encounter a lot of these, I would say, very challenging stories. But on the other hand, we have seen people reclaim their lives. A final example is Ukraine. There was a young woman and her family who had an injury and an amputation, and just didn't know exactly how to access services that were there locally and available. So sometimes, as I mentioned earlier, we're connecting people to services that exist because we're a training organization and we look to identify gaps. Sometimes we're providing those services ourselves, but a big part of that is the emotional and psychological support for the child and for the family involved.
And there's an interesting follow-on there, isn't there, Lord Darcy? Because look, what Nancy has outlined is changing mindsets on the ground so that people can live together, work together, and enjoy the long lives that all of us take for granted. But my question to you is changing mindsets above that, upstairs, okay, in bigger, broader political levels. My point is, how are we going to integrate the rights of conjoined twins into broader agendas? In other words, changing those mindsets at the top so that in 10 years' time, if you and I are talking, I'm not having to ask you this question.
Absolutely, and I think you're absolutely correct. This is a global challenge, this is a global problem, because most of the centers doing this type of complicated surgery are very centralized. One of the greatest obstacles in terms of the politics of the world we live in at the moment is how do you get these patients across to different countries? Visas. And by the way, it's not just the visa for the child and the family, but even the visa for the surgeon who may wish to go there. Ideally, these should be coming over to a major center rather than a surgeon going off to operate elsewhere. These are the really big big challenges.
And can I just say, I find that quite extraordinary because, I'm sorry, I don't wish to sound political. You and I are from the UK, so we know that when we're talking about people movement, it is a hot potato. A surgeon who is trying to save a child's life is treated as a suspect, as an immigrant, in inverted commas.
I wouldn't go as far as describing it that way, but I'm only describing the challenge. Absolutely,
yeah.
Getting a child. I mean, by the way, the legal framework around conjoined twins, I think, also is immature globally. It's not just the UK issues. How do we really look at in many ways, the existing laws in terms of the individual rights of the twins, and you know, who are the guardians, who are the advocates? Most lawyers wouldn't really know much about the subject matter. You know, the legal training of this is also very, very important. You're not going to see many court cases in this type of area, but that will get bigger and bigger. The ethics of this, obviously, I mean, you know, the terms of the ethical guidelines of separation, if there is a consensus or an agreement on that.
Yeah, because there's some huge court cases in the United Kingdom about this, particularly where you've got one twin who is very strong. The weaker twin is surviving off the strength of the most physiologically robust of the children.
Absolutely, and these are issues that we as physicians keep away. I mean, it becomes very complicated. Lawyers are involved, you know, and it really makes something that we're all aspire to create value and improvement and save lives. We are really entangled with a fairly complex legal system which may not understand all of this.
And that's important, Dr. Kanawi, because, you know, we talk about the medical challenges if you are performing surgery on conjoined twins, but as Dr. Dazi pointed out, it's also the ethical as well, because your job is to help the patient and to find yourselves being caught up in these situations which may involve a court action, a legal action in certain countries.
Certainly, I think it is. It's always, you know, something that, you know, medical profession, you know, deals with this, you know, in these difficult situations, and clearly, you know, supporting this through the different ethical committees, through as well enabling, you know, systems to do that. I think is a must, and there is no doubt as well trying to build, you know, the whole process of taking care of these patients with their families and extended families. You know, sometimes in our cases, some of the grandparents as well come with the children, and we give them that kind of an opportunity to make sure that everyone becomes on board. You know, becomes aware that it is something that has to be taken care of, and. I'm sure, you know, the medical team and the ethical team and the legal team go through different things related to, I'm not going to talk about the technicalities of surgeries, but sometimes, you know, some of the children are living on the systems of each other. So you need to really make that very important, critical decision. Somehow it is probably intraoperatively within the operating room to make sure that, you know, you really make the right choice, and we will not develop this without, you know, extensive experience and skills and competency. Otherwise, you will really compromise the outcome of maybe both, not only one. So this is a challenging situation, and really having everyone on board and getting as well NGOs and other supportive agencies and you know, human rights as well, activists and advocates probably will enhance this even further. So truly, you know, what we see today as well is how the system of Saudi Arabia as well, with the support and with the actually commitment of Dr. Rabia and the King Salman Center to bring these people almost 20 years later to really keep continuing to build this capacity. And this is not easy. I'm sure, you know, the team who worked very hard to really put this on today and reaching to this, you know, international day, made sure that we really keep them integrated within the communities. And this is very important. I think the parents and the community, if they know this is happening, they will become very supportive, and as well the legal rights will be as well observed and as well committed to.
Thank you very much, and I know, Nancy, you wanted to follow up on that.
Yes, I was just thinking a bit about some of the important players in the work that we do, both at the ground level and at the highest levels. And I always say, you know, for a ground operational organization like International Medical Corps, one of the most important kinds of support that we can get, whether it be from Chaos Relief or USAID or DFID or so many other governments and foundations around the world, is the flexibility to identify what the gaps are in an environment, in a community, and then to figure out creatively, based on what's happening in that community, how to help. And it requires a lot of flexibility, especially in conflict zones or after natural disasters like earthquakes and tsunamis, where we also responded. Because the environment on the ground has changed. It's changing every week. Sometimes it's changing every day. And so that kind of donor flexibility that allows organizations to make the right judgments and to make the right decisions based on the needs of the people that we are serving, and the fact that what maybe worked last year no longer works anymore. And so these donors I mentioned, and many, many other donors, play a critical role in helping us to reach people and to really affecting the change that we need to in these communities and really save more lives more efficiently. So I just wanted to mention that as an important part of this whole arena of trying to help people and reach people where they are, given that their environment changes all of the time.
Okay, thank you so much for that, Nancy. I want to close up by putting a final question to Dr. Arabia. I did a little bit of reading on the conjoined twins, and it's quite fascinating what's emerged. For example, conjoined twins having a higher mortality rate, and also female babies perhaps more likely to survive than males. But there are also geographical disparities. So you've got twins, a slightly higher instance of conjoined twins in Southwest Asia and Africa. So given all of these realities and the medical realities that you have confronted in your work, my question to you is, what are the strategies that need to be developed for timely intervention and, above all, coordination to support the twins and their families, particularly those who are coming from least developed countries?
Thank you, Juliet. If you allow me, let me comment on just one or two topics that has been mentioned by my friend Lord Darzi, and also by Nancy and Dr. Kanawi. When you mentioned the ethics, I think the ethics is not only two children, it's the mother. We should not forget. Some of the procedures there are surgeons in this room and they know the technicality. Sometimes we have to do, in rare cases, the surgery just depending on the placenta of the mother, which is called an exit procedure. So the ethics of mother, child, it's a very complex ethics on those. Dr. Ganawi mentioned if they share one organ. Let me tell you, if they share one genitalia, which is especially for boys, this is also technically not easy. And you need a very skilled pediatric urologist who studies them very well to ensure that can we split, for example, the phallus or something. This is taken in the operating room, very difficult decisions. And that's why the surgeons should have also some knowledge about the ethics. Now going about conflict zone, and Nancy mentioned this clearly, let me give you two programs. For example, earthquake in Syria and Turkey. KS Relief has launched the largest cochlear implant ever for refugees between Turkey and Syria. And it's a world record, just for everybody to know, to do 40 cochlear implants in one day has not happened in civilian circumstances in the best centers. For volunteers to go from Saudi Arabia and to do it in a very difficult situation, this is something that we have also to thank partner NGOs, UN and other players. This is where foreign ministries, diplomats, ambassadors can help. Now going also back to conjoined twins and your answer, I think we have to live in, and now we are living in an era of technology. And those children come from very disabled countries. Now, how can volunteers, this is what I'm suggesting, how could volunteers help those countries? I think we have many women in this room, and my message to them is early diagnosis. There is now ethical changes. We can diagnose conjoined twins as early as 8 to 9 weeks of gestation. And there are many laws that may allow abortion for certain complex, difficult cases. So this is something that I want to put it. How can we allow disabled communities to have an access to early antenatal care, whether it is by remote support or by visiting volunteers or the help of medical international humanitarian NGOs like IMC and others. Now, lastly, I want to also to mention that we should not, conjoined twins is an example of many complex cases and rare cases that we have in the world. And unless we start coordinating beyond the politics, you mentioned the politics here. Let me tell you with conjoined twins. During the conflict in Yemen, we have brought 3 conjoined twins from Yemen, from Sana'a, from Sa'da, and from Ta'az, during the complete season Ta'az. And this is where the politicians and also UN agencies have coordinated, and we thank them for coordinating that. So such coordination and integration is important, and this forum on this meeting is setting the basis for it. Thank you.
Thank you very much. I think it's fair to say that the whole subject has been incredibly broadened, not just in terms of the medical side of things, but also the political side, the practical difficulties on the ground, and the work that is going on at community level and above. So panel, thank you so much for your contributions. What we're going to do now is to hear a pre-recorded message from UNICEF, in fact, the representative, Her Excellency Catherine Mary Russell of the United Nations Children's Fund. Can we roll the VT, please? Thank you.
It's an honor to join you virtually for this first ever international conference on conjoined twins. I so appreciate the Kingdom of Saudi Arabia's long dedication and work in supporting conjoined twins. UNICEF believes in the power of partnership, and we value the close collaboration with the King Salman Humanitarian Aid and Relief Center. Together, we can create a world where every child, including those with unique and significant needs like conjoined twins, can live healthy, fulfilling lives. Conjoined twins face unique challenges that require inclusive healthcare and educational systems that prioritize equal access. UNICEF is committed to working closely with partners like the KS Relief to create supportive environments where every child can thrive. I appreciate our joint efforts in supporting children with disabilities and their families, including through digital information. This work will offer caregivers and parents critical information and resources to ensure that children with special needs, regardless of their circumstances, are provided with the care and support they need. This platform will not only offer tools, but will be a beacon of hope and empowerment for countless families worldwide. Thank you to KS Relief and to all the incredible participants who are moving this important mission forward. Together, we can help ensure that children everywhere have access to healthcare, education, and opportunities that uphold their rights and dignity. Thank you so much.
Okay, so this is where I stand up. That was Catherine Mary Russell of UNICEF, the United Nations Children's Fund. It is that point in proceedings where we will now take questions from the audience. There are microphones available, so if you wish to put a question to members of our panel, please stand up. In fact, raise your hand. A microphone will be brought to you if you can stand up and also introduce yourself. If you represent an organization, then please name the organization. So would anyone wish to put a question to members of our panel? The gentleman over here, from where I am, he's on the third row, the gentleman in the dark suit. Can somebody take a microphone to the gentleman over there, please? His hand is raised. Over here. The chair rows are very long, so there's quite a bit of running that takes place. It's like athleticism. That's fantastic. There's also a gentleman over there, so if we can get the microphone. Ooh, can we have the microphone, please? The gentleman is standing. Thank you very much. Is the microphone on the way? I believe it might be. If not, you're going to have to bellow. You're going to have to frame your hands into a foghorn and shout it out. Fantastic.
Can everyone hear me?
Yes, we can hear you. Thank you. Can you introduce yourself and the organisation you represent, please?
So my name is Mohammed, and I'm from Global Impact Consultancy Limited. We're a consultancy that specialises in third-party monitoring and evaluation. I've just got two questions, if I may. The first one, you spoke of lesson sharing. So have there been any medical innovations or discoveries that originated from the unique challenges presented by treating conjoined twins that are now being applied to areas of other medicine? Just a question to the panel. And the second one, working in monitoring and evaluation, what are the monitoring frameworks that are currently in place to evaluate the long-term physical, emotional and psychological outcomes for conjoined twins after medical interventions?
Thank you so much for that. So the first question is lesson sharing, initiatives which have generated great ideas, etc., which in turn have been followed through. Who would like to tackle that one? You're very shy.
Well, I'll have a go. Obviously, innovation diffused both ways. It's not unidirectional, so it's not going to be from one to the other. I think the world has learned a lot from the innovations under the leadership of Dr. Rabia here in terms of the complexity of this and how you learn the skills to do this. So that's one diffusion of innovation. The reverse would be in other sectors. I think in recent times it's mostly really about imaging, more sophisticated imaging rather than just purely ultrasound, MRIs, reconstruction, creating models that surgeons could practice on before they embark on operation. If there is a virtual reality platform, for example, you can actually practice many of these procedures. You can even look at the impact of the separation physiologically, if you have a sophisticated computing power, in terms of predicting what the impact would be on a system-based, cardiovascular, respiratory, for example, if that's separation. I think artificial intelligence will come towards this eventually. Obviously, it's helping us with our daily jobs at the moment, but it could even have a huge impact in separation and the accuracy of imaging and the borders, and not to create any collateral damage, per se, as you're doing separations. Fetal endoscopy, so there's plenty of opportunities that we can learn from, but more importantly, the world could learn on from this highly specialized field.
Thank you. Dr. Kanawi, would you like to add to that at all, please?
Yeah, I would like to add that with each surgery, I think it's being done by the team, we usually involve people from outside our institutions. We bring expertise from different disciplines to join, even at the level of technical staff or allied health, and that's very important, I think, to expand the skills and competencies, and as well it will help these surgeons or assistant surgeons or anesthesiologists or anesthesia technicians and respiratory therapists and the rest to help them their practice in other cases. So I think it is as well the complexities and the difficulties of these challenging cases as well will help to build the skills of the different care providers in other cases. So I think it is essential that we as well not only centralize or make it more national center, but as well introducing at whatever level for each surgeries from the other hospitals nearby you, I think is quite important.
Fantastic. Dr. Arabia.
Well, thank you. Thank you for the question. It's a very good question. The first part of the question, I agree with what has been said. I think digitalization, artificial intelligence is going to change a lot in the future for conjoined twins. And I mentioned earlier, early diagnosis is very, very important. If you diagnose conjoined twins as early as 8 or 9 weeks of gestation, there are a lot of things that you could do much earlier, whether counseling, whether education, whether abortion, you name it. There are a lot of things. Secondly, my friend Lord Darzi mentioned fetal surgery. Fetal surgery or endoscopy can not only diagnose, but can also treat And this is an emerging also a new era, whether you can reduce one child and block the feeding arteries so that you are left with one twin or the other. This is something is coming. Now, when they are born, again, the era, it's a huge, whether you will do ultrasound, dynamic CT scan, MRI, it depends on the twins. So it's very important to have the experience, the rehearsal. But your second part of the question, which is related to the follow-up, it's very important. I think the follow-up, whether it is on the psychology of children, whether it is in their physical capability, whether in their, what has happened to them. And tomorrow there is a session which I encourage you attend it. That side event is actually about that question and will be attended by one of our twins. They are graduating from university and they will tell you their path from separation till today. I'll stop here.
Thank you very much. Is there anybody else who would like to? This gentleman here, can we give a microphone to this gentleman over here, please? If you could give us your name and the organization you represent, please. Thank you. Is the microphone working? Just tap it.
Working?
Yeah, it is. That's great. We can hear you.
Thank you very much for this arranging international conference. I am Professor Dr. Mohammed Sharif, consultant pediatric surgeon from King Edward Medical University, Lahore, Pakistan, and now recently I joined Qasim Health Cluster. So my question is that we are receiving so many patients of this conjoined twin in Pakistan, and I was in the part of team for successful separation of Amphilopagus at Children's Hospital Lahore in 2008. And now we follow the patient up to the age of 6 years, they were okay. But my question is that these conjoined twins in Pakistan, due to some anesthesia changes and economical issues, they are being transferred from one hospital to the other hospital. Is there any way to send them to this higher center in Saudi Arabia, where there is a high volume surgery of such twins, so that these twins can be saved? So this is my question to Dr. Rabia, respected health minister. He is one of the authority in separation of conjoined twins. Thank you very much.
Thank you. So it's actually transferring patients in Pakistan to Saudi Arabia.
Yeah, and also the out of cost, because they are economical issues for them. They cannot tolerate the charges.
Okay, Dr. Al-Rabia, and also if Dr. Jan, if you'd also like to contribute, but Dr. Al-Rabia first, please.
Well, if you can start.
Actually, would you like to start that first then, please, Dr. Jan?
I think as far as support from the government and the Foreign Office is required, that will be ensured. And we can liaise with the King Salman Relief Center here for transportation and support to the families. But I'd request His Excellency Dr. Rabia to respond how this can be supported.
Well, thank you, Your Excellency. Well, first of all, welcome my colleague, and happy to have a professor from in the same field from Pakistan. My first immediate answer is yes. First of all, the relationship between the Kingdom of Saudi Arabia and Pakistan is very strong, but Saudi Arabia has opened its program for all children who are unfortunate to be conjoined twins, and they have been accepted by our leaders from all over. We have them from 26 countries, and Pakistan, we have received conjoined twins from Pakistan. You will see them later on today. We have lovely girls who have been separated from Pakistan, and they have come back to meet with you all later on today. So my immediate answer, I think as soon as you diagnose them, please communicate with us. Our foreign ministry is very active, and our ambassador in Pakistan is very active, and the relation between our embassy and the foreign ministry in Pakistan is very strong.
Thank you very much. Now, there's a gentleman here who raised his hand. If we could come to the front row, please, with a microphone. Thank you very much. The gentleman here. Can we have a microphone, please? It's on its way. Please be assured. Here it is. Thank you so much. Thank you.
My name is Hani Najam. I'm a practicing congenital heart surgeon at the Cleveland Clinic. My entire experience with conjoined twin separation is during my tenure at the National Guard Hospital, which is really spanned over 17 years, and I'm so proud to be part of that team Now, when I was asked to come and speak in this meeting, I did ask many surgeons, colleagues in the United States, how many have they done? And compared to the experience that I had at the National Guard, none of them have had any of that experience. So I was privileged to be part of that team. Now, going forward for these conjoined twins, first, I think I do agree with the panelists that there have to be centers of excellence to do this, just like all advanced heart surgeries. And it's not about only taking care of the conjoined twins only. I remember in one of the conjoined twins, just in follow-up of Dr. Kanawi's comment, I had to do a coronary bypass surgery on the father. I think probably the father is from Oman, he's going to be here. So it's not only taking care of the actual conjoined twins, he happened to be stressed out, had a heart attack, and I had to do the heart surgery on him. Is there any possibility of, we're talking about transfer of patients, conjoined twins families, that to create an international fund for those patients that can be transferred to centers of excellence? There is no place on earth would have one center would have a large experience. It doesn't matter how busy they are, except that if they become a referral center for such patients.
Thank you. So you're talking about having an international fund, basically, so that it's not going to be difficult actually accessing patients, getting them through, if they're connected to these other centers where this type of surgery is carried out, but the fund is the key to it.
Absolutely, and they would be maybe one in each continent where they can do these cases. Otherwise, the outcome is not going to advance so much.
Okay, fantastic. Would the panel like to handle that question, please? The idea, the importance of actually having, please, Dr. Arabia.
Well, Dr. Najim, you are sneaking in our resolutions ahead of us. So I think your suggestion is actually, in one of the discussions in the coming 2 days, is about creating a fund. I think having a center to do them is one issue. We are fortunate in Saudi Arabia that the Custodian of the Two Holy Mosques and the Crown Prince have sponsored all of the twins, and we can do them. But also there are expenses that are needed not only for the surgery, but also for the follow-up. And that's why there will be in the resolutions a recommendation to create some sort of a fund. And that's where we are, as humanitarians, we talk about the public-private partnership. We should not all be shouldered by governments. We should think about public-private partnership, donations from businessmen and others. This is something that will be put in the resolutions. Thank you.
We are running out of time, unfortunately. This is clearly one of those subjects which everybody has engaged in. But there was a gentleman here who's raising his phone. Could you stand up, please, and make yourself clear to the microphone operators? Can we bring a microphone, please, to this gentleman? It will have to be the last question, I'm afraid, because time is running very, very tight, but I'm sure that you will be able to address some of the questions to the panel in the later sessions. Is that correct? Yeah, well, fantastic. If it's not correct, then I apologize. Fantastic. So can we bring a microphone, please, to the gentleman who's wearing the brown gilet? If we can get a microphone to him very, very quickly, because time is running very tight, and there is a lot that we have to get through. Thank you so much. That is excellent. And apologies to other members of the audience who wanted to put questions to the panel, but you will be able to talk to them because there are other sessions to follow this one. Thank you very much. So if you could introduce yourself and the organization you represent, please. Thank you.
It's arrived now.
Yeah, well done.
Yes. Assalamu alaikum. My name is Ahmed Al-Muhammad. I'm a legal advisor. I'm the one who's worked with Dr. Rabia in the legal time in this twins congenited. Dr. Rabia, he take care about every small things, even the approved, even the legal issues, and that's we need to, from Dr. Rabia, explain how he take care in the operation and legal issues and ethics. The second thing, last week the International Day for Child. And today we give to all the world this small message. Saudi Arabia giving all the child and all the world the rights of life. Thank you very much.
Okay, Dr. Arabia. Okay. So very, very briefly, because we must close. Please, thank you. Very, very briefly, please. Thank you. The ethics.
Well, thank you, Ahmed. for your question. Well, I think any surgeon, and we have respected surgeons in the audience who deal with conjoined twins, have to have conductivity with the ethical people, legal people, and in countries like Saudi Arabia, religious people. So I remember from the first twin, we have communicated with the religious leaders also, and lawyers and others. But also you have to have a basic knowledge when you operate, because you cannot stop the surgery and say, I want to ask a lawyer. So you have to have that knowledge, and that's where experience is needed. And your question about the rights of life for children, that's absolutely true. You cannot, the surgeons should not be a weapon to kill a child. You should aim to save the life of both twins, unless there are medical conditions that one of them doesn't have the prerequisites of life. And this is where the ethics comes, and this is where the decisions needed by ethical experts, surgeons, and lawyers. Thank you.
Okay, thank you very much for that. I'm sorry that we have to close this now. And in fact, I would actually like to hand the closing remarks, please, to Dr. Al-Rabia, really summarizing the takeaways from this, and above all, the action plan to follow up the initiatives discussed. But very, very briefly, I will hand the floor to you, Dr. Al-Rabia.
I think I talked a lot, but I will be quick because our guest of honor is arriving. Well, actually, first of all, let me thank my colleagues who have participated fully in this session. I think I have learned a lot from them, but I think all of us agree that rare anomalies like conjoined twins is something that needs the attention of the societies. We thank actually the government of Saudi Arabia and the foreign ministry for actually working with the UN, and we thank the United Nations also, and we thank Ambassador Abdulaziz Al-Wasil, Dr. Abdulaziz Al-Wasil, for working with the UN to have a World Day for Conjoined Twins. I think this should be the beginning of continuous collaborations between governments, between United Nations organizations, international NGOs, local and regional NGOs, that they should communicate with leading centers, whether it is like the Saudi National Program for Conjoined Twins, Great Ormond Hospital, and others, and create what we are launching today, a website that will bring registry, research, advocacy, communication, and also awareness for families. This is the takeaway that we should agree on, and we should not forget the well-being and the rights and the ethics of conjoined twins.
Thank you very much, panel. Thank you. Okay, I think that wraps up this part of the session. Of course, there will be other sessions to follow, but thank you so much for your attendance, and above all, thank you so much for those excellent questions. Thank you.
Thank you, Ms. Foster, for facilitating such an insightful discussion. I would also like to extend my heartfelt gratitude to His Excellency Dr. Abdullah Rabia and all of our esteemed panelists for sharing their invaluable perspectives and inspiring us with their leadership and dedication to this cause. We will now take a break as we prepare for the opening ceremony. Please remain seated as we make final arrangements. Thank you.